Hello and welcome to my Acromegaly presentation. Um, this is a picture of me and Robert Wadlow. If you've ever been to Fast Eddie's or over to Alton, Illinois, he was from there, and he was like the tallest man I think on record. But we both had acro, which is slang. Fun fact. Okay, let's jump into this. So I chose to do my project on acromegaly. The reason why is because that lovely picture of me, that was after surgery. In 2018, I had a pituitary tumor removed. It's called acromegaly, but me and my friends called it Helga because I wasn't really myself. So they kind of called me Helga when I had it. And acromegaly is a rare hormonal disorder caused by excess growth hormone. But I got mine after puberty. So I didn't get giant and tall like Robert Wadlow. My bones, my growth plates were already fused and I've stopped growing. So what that means is that instead of getting taller, everything gets bigger. So my hands, my feet, my jaw, my temper wasn't regulated, and I was also just sick all the time. That was fun. Okay. So the Mayo Clinic describes acromegaly, the definition, as GERD. No, I'm just kidding. Acromegaly is a rare condition in adults that cause some bones, organs, and other tissues to grow bigger. A small gland in the brain called the pituitary gland drives these changes by making too much growth hormone, and it usually happens because of a tumor on the pituitary gland. Although the tumor isn't cancer, thank God, my grandma died of brain cancer, so big scare for this one right here. The condition causes your hands, feet, and face to enlarge and lead to serious health problems if left untreated. Acromegaly is not a common disease. It only affects about 60 people out of every million. And that's only about 3 to 4 new people per million get diagnosed a year. So I don't know, there's 8 million. Oh, there's like 8 billion. Never mind. It usually happens in middle-aged adults, but it can take a long time to diagnose because how slow the changes happen over time. Men and women are both affected equally. Because it's so rare, sometimes it gets misdiagnosed, which also delays treatment and being diagnosed. And yes, the main causes of acromegaly is a tumor on the pituitary gland. It makes too much growth hormone. These tumors are usually benign, not cancer, but they cause a lot of problems because of the hormone imbalance with the IGF-1, the extra hormone. That's what causes the things. There it is. Okay, the excess growth hormone causes the liver to make more and too much IGF-1, which is what causes the body parts to grow. In rare cases, other tumors that are not in the brain can also make growth hormone, or a hormone that tells the pituitary gland to make extra growth hormone. The systemic impact. So basically, all your soft tissues start to grow. The hands, feet, face, soft tissues in the body enlarge. Some common, more serious complications, though, include like joint pain, which is terrible, still is. Arthritis, sleep apnea due to swelling of the throat, high blood sugar, diabetes, heart problems like high blood pressure or an enlarged heart. So like if I ever have a baby, they told me I would have to be treated as like a special care and like extra monitored by a heart doctor because of the whole enlarged heart thing. I'm the opposite of the Grinch. Nerve issues like carpal tunnel syndrome. It was terrible. My hands were numb constantly. Vision problems. I was hospitalized for eye pain. And a higher risk of colon cancer. So colonoscopies. Those are fun. And cardiovascular issues, including hypertension, arrhythmias, and cardiomegaly, which is the increased risk of heart failure. Okay. Sorry, Joe just came in and gave me pizza. I'm done with it. If left untreated, acromegaly can become life-threatening. The whole enlarged heart thing and colon thing. On a physical exam, doctors might notice a large jaw or forehead, spaces between the teeth getting wider, swelling in the hands and feet, and a deeper voice. Like I had vocal cord surgery, wrecked my voice. All part of this whole thing. The skin may appear thick or oily. That happened. Like I have really, really thick skin. It's kind of weird. I don't know. The tongue might be enlarged. Joint stiffness is also common. Because these symptoms progress gradually, many individuals remain unaware of the disease for several years. Oh, definitely skin tags. They would always check me for any new skin tags. Voice deepening. Yeah, I don't have a cute voice anymore. I promise I used to. I don't know if it was more annoying or less annoying. Okay. Many of the symptoms come on slowly and can be easy to miss. People with acromegaly often feel tired and may have frequent body aches. In my personal experience, I was bartending and waitressing 80 hours a week, like every week for a really long time, and I just thought that that was life. Like everything was just supposed to hurt, and I was dehydrated or something. It just didn't feel good. Rings or shoes may no longer fit, so I had to throw away all my shoes that I had ever collected and loved. That definitely happened. I only grew like probably like a size, half a size, so not terrible like some other people. But your rings or shoes may no longer fit. So every time I go to my appointments, they're like, "How are your rings?" Because I always wear rings, and that's kind of one of the reasons why. Just like a little tall tale. That was like one of my biggest like signs. Your nose and forehead may become more pronounced, like we saw in the first picture on the first slide. Definitely saw some of that going on. Mine got bigger. Hopefully you can't tell. Headaches are common. Some people experience more sweating than usual, mood changes. There's that Helga, or problems with vision. I think that's why I wear glasses. Clinical presentation. So again, kind of some of those things we talked about, but visible changes throughout the body to help identify the condition. We have those. But the soft tissue overgrowth can also lead to like thickened lips and tongue. That definitely happened. My mom always used to make fun of me and tell me I had no upper lip, and so I do now a little bit. It's better than it was. And then dental spacing is also common due to the jaw growth, but I think I go into that a little later. Ha. To diagnose acromegaly, doctors usually begin with a blood test for the IGF-1 hormone, which is often high in people with the condition. A follow-up test called an oral glucose tolerance test can confirm diagnosis. All you mamas out there, you know what that is. You got to drink the drink and then they test you. But in a healthy person, growth hormone levels should stop or should drop after drinking the sugary drink. But with someone like me, they stayed really high. All the blood was taken. All the blood. Like, I'm not even afraid of it anymore. And I used to be like, I can't do it kind of a person. Growth hormone levels. So sorry. But an MRI is basically how they identify it, and they can visually see it on an MRI on your pituitary. But additional tests include vision exams and then like that diabetes screening with the glucose test, colonoscopies for polyps, and then cardiac evaluation for endocardiography to assess for hypertrophy and dysfunction. The pituitary treatment is a surgical removal of the tumor through a procedure called transsphenoidal surgery, which I love. I used to think I was so smart for knowing that, which involves assessing the pituitary gland through the nasal cavity. If surgery is not completely effective, medications can be prescribed. They're injections 3 times a day. Not fun. I actually had an allergic reaction to it. It made my whole body feel like I was on fire. Literally. So, and then in some cases they use radiation to help shrink the tumor. And then maybe they can take it out with surgery, but not everybody's so lucky with that. But there's kind of, I had like a picture and it shows that's what they do. They drill a hole in your sinus. They didn't have to shave my head. They already went in through a hole that I already have, and they pulled the tumor out like a grape through my nose, is what I was told. Acromegaly frequently presents with noticeable changes in the face, again, jaw, lips, forehead. Patients develop the enlarged jawbone and increased spacing with the teeth, and then the enlarged tongue, the macroglossia, and thickened lips and prominent frontal and nasal bones. These changes can lead to malocclusion. So this is like the oral side of things, the R side of things. I was on a Facebook group with like not like a support group, but like everybody talked about their stuff. I guess that's what a support group is. So there are some people who can't chew. They can't close their mouths. It's really sad how out of hand it can get. But difficulty chewing, sleep apnea, medications used to treat acro really don't have any direct oral side effects, but most patients, you might need to take more time with them because their jaws can ache due to their arthritis and their joint pain. So just make sure that they're comfortable and feel safe, and let them know that if they need to take a break, that it's definitely okay. But local anesthesia should be administered cautiously, particularly for those cardiovascular people. Basically, I'm more at risk for cardiovascular things, but I don't have anything going on, but I'm more at risk for things to go on. But some people could have hypertension or high blood pressure. I think I go on to the next slide with that. No, I don't. It won't let me go back. Okay, so yeah, caution with epi with people with heart problems, but we know that from all our study guides. So learning about acromegaly in depth has given me a new appreciation for how complex our body truly is. Understanding medical management, medications, and oral manifestations help me see how this condition affects much more than just our physical appearance. I didn't realize all the internal changes really. I mean, I knew tip of the iceberg, but I really dove into it this time. All the internal things that can happen, your metabolism and long-term health isn't always visible. Before learning of all this, I only knew how I felt every day, and not about the long-lasting effects inside my body. It can be a very debilitating condition. My personal experience was thankfully a lot better than most, and better than I've described. Having gone through pituitary surgery myself, I know the fear and uncertainty that comes with any type of diagnosis. But I really learned a lot about the human body and how resilient we are. And the knowledge from this research helped me understand why certain symptoms happen and how treatments work and bring the body back into balance. But now I really know how important early detection is, because I kept getting told, you're young, you're healthy, you'll be fine, and it wasn't fine. So self-advocacy in the medical field, I hope if you're watching this, you always self-advocate for yourself and for your children. I've just come a long way on my journey, and studying acromegaly has really helped deepen my appreciation for modern medicine. Yeah, and then my reference page is cool. It's from The Princess Bride. That's Andre the Giant. If you haven't seen it, go watch it. If you have seen it, you know what I'm talking about. Thank you for watching.